How do we treat victims of an explosion? The most important part of treating someone who has been involved in an explosion is to perform a very complete workup. Sometimes it is easy to get distracted by the obvious injuries and miss other important ones. For example, if a person has had their leg blown off, it is easy to focus all of your attention on the leg while missing a potential head injury. So a systematic approach is required. Doctors who regularly treat trauma victims have a stepwise approach to managing all injured patients. However, understanding the principles of blast injuries helps doctors become aware of some possible injuries that may not be obvious. Some important points are: always look at the victim's entire body. Every inch of their body must be examined for signs of penetration. Small pieces of metal or glass can cause very small skin holes on the outside, but can still hit vital organs or blood vessels on the inside. All puncture wounds must be thoroughly examined and X-rays done as needed. Always anticipate a head injury. If the patient is confused at all, does not remember the event, or is acting strangely, they may have a brain injury from the blast wave and should get a CT scan of their head. The ears of every patient should be examined. The eardrum should be looked at for signs of rupture. Once the patient is stable and recovered, a formal hearing test done by an audiologist should be considered. Be aware of possible internal bleeding or internal damage. We discussed earlier how the liver, spleen, or kidneys can be damaged by the blast wave. This bleeding can be slow, and it may take several hours to recognize. A CT scan of the abdomen should be considered in all blast-injured patients. If a CT cannot be done, then the patient should be observed for several hours or even days to make sure that internal bleeding does not occur. Blast wave injuries to the intestines can take 2 or 3 days to be recognized. Even if a patient is sent home from the hospital, they should be counseled on what sort of symptoms are worrisome and instructed to return to the hospital immediately should those symptoms occur. Always look for inhalation injury. The lung damage caused by breathing in harmful fumes and smoke may not make the patient sick for several hours after the explosion. All blast victims should have a chest X-ray, and if their breathing worsens, the chest X-ray should be repeated. All victims also should be placed on monitors to follow their blood oxygen levels. Blast victims can require oxygen masks or may even need to be put on a ventilator if lung damage is severe. Since explosions are often random accidents or seemingly random acts of violence, victims can be troubled by the experience. They may have witnessed other people around them horribly injured or killed. Post-traumatic stress disorder is a very well-studied condition that can ruin a victim's life and even lead to suicide. All patients who have been involved in an explosion, especially those caused by a terrorist act, should be referred to a mental health professional for a complete evaluation. Sometimes the most devastating consequences of a blast can be emotional. The mental health of the victim is just as important in the long run as their physical injuries.